Hi everyone, my name is Kaylee and I am the Chief Informatics Officer for our organization, and I want to talk to you, our informatics team, about the legal and ethical issues in healthcare informatics and develop an education plan to implement to increase awareness on how this has implications on patient care outcomes. So, some ethical issues that we need to discuss, just a general baseline. Justice is a big deal in our organization. Justice is basically the right for everyone to be treated fairly and equally, and informatics does play a major role in that. So, informatics is becoming a lot more technology heavy with things like artificial intelligence, and there are some implications of leading to injustices when we use such technology in our profession. And we got to talk about bias. So, artificial intelligence, like technology, is not really capable of filtering out biases that we might be perpetuating. Because if artificial intelligence is taking data that we are giving it that is already inherently biased, then biases that increase injustice can be further perpetuated by this technology in our informatics. So, it's something we must be aware of. And then, in terms of legal issues, HIPAA, that law that protects everyone for privacy, the Health Insurance Portability and Accountability Act, that is a big deal because it protects everyone's right to privacy. And this must coincide with our organization making sure that there's proper surveillance and protection of the information that we are using in our informatics. And we have to make sure that data breaches are not happening with the technology that we are integrating, causing legal parameters that we must abide by. So, some objectives that we're going to talk about, different integration of technology in our informatics. We're going to talk about how AI can perpetuate those, which we already did. We're going to talk about resources to guide our legal and ethical parameters, and then how we can evaluate the education that we give to our organization. So, instruction modalities for this education plan for legal and ethical parameters must be knowledge based. So, we were thinking something like webinars, learning modules, and discussion forums because people have to increase their baseline knowledge on legal and ethical issues as it relates to healthcare and how it's going to impact patient outcomes. So, it must be a heavy knowledge foundation that we bolster. So, that's why our modalities are going to be with that approach. And then once everyone has that baseline understanding, we can incorporate things like simulation learning to have realistic application of that knowledge in practice in the profession. Some supportive resources to consider. A HEMA is basically just setting a parameter for legal and ethical implications that safeguard patient data. HIPAA, we already talked about. High tech complements HIPAA with integration of technology like health records and all of that house our data in our organization. And then the Informatics Code of Ethics, which just sets a standardization of care for us to abide by in our informatics team. Our education plan timeline is going to be about 6 or 7 months. It'll take about 2 months for us to properly assess where the knowledge deficits are so we can then go from there and make a education plan that addresses those knowledge deficits. And then developing the curriculum, like we previously mentioned, it's going to be more didactic at first while we bolster that knowledge basis and foundation for everyone. And then implementing that education can take a couple of months as we integrate it smoothly into everyone's scheduling and timelines, and making sure that we've given everyone time to fully take in that knowledge and understand it well. And then evaluation of that is going to be ongoing, and we can use our data in an extended time period to evaluate how have we helped increase knowledge and prevent these implications that are impacting patient care. We need to recruit by raising awareness and incentivizing our organization to learn. And then we have to communicate that information in a way that we're understanding how they are receiving our information. So that can be things like teach back and application, like clinical based scenarios. And we have to have contingencies as a backup plan, which is why we have to incorporate simulation based learning as a different method if people are not receiving the didactic education well. And then we must evaluate with other things that I already mentioned, like teach back opportunities, discussion forums where everyone can share the knowledge that they've learned and their perceptions on these legal and ethical implications, and also use that data in an extended time period to see how have we reduced these legal or ethical violations and where is there room in our demographics to improve our knowledge for everyone.